Thank you so much for joining us on the Thrive Ahead YouTube channel. Today's video features the Centers for Medicare and Medicaid Services Nursing Home Compare Star Rating System. And we have one of our experts at Thrive to discuss how that star rating system works and how it could be useful for you as you research short-term care facilities for rehab. We hope you find this helpful and feel free to subscribe to our channel today. So right now you can see we are at medicare.gov/care-compare/. And with us today is one of our nursing leaders, Michelle with Thrive. So thank you so much, Michelle, for joining us today. Very exciting to go through this and help out our listeners and our viewers who are interested in obviously investigating this type of rating system. What does this mean as they choose short-term care facilities for themselves or their loved ones? So this is a helpful site that has many tools within it. So we'll start. Here you can type in, when you go to the main page, you can search by location. You would select the provider type. So for our purposes, Thrive, we are a nursing home system here. So nursing homes. If you want to look at a specific facility, you can do that. But for the purpose of today's tutorial here, we want to show you all of the locations within a certain demographic or geographic area. Okay. And then here on the right, you can see there's the map too. So if you want to zoom in on a specific area to see what's really close, this can be very helpful. And then as you look on the left-hand side here, it'll show you each of the facilities within a certain mile radius. At the top, you can filter it by the distance, the overall rating. So if you want to look at just 5-star facilities only, you can do that, or lower, feel free to select. And then anything else, any other filters you can choose up here. So we're going to scroll to our center, Thrive of Fox Valley, which is right here. And as you can see, Thrive of Fox Valley has a 5-star rating. And Michelle, feel free if we want to just dive right in here and talk a little bit more about what that means.
Okay, so 5-star Nursing Home Compare came up with the 5-star rating in 2009, really to help consumers learn a little bit more about the facility and what's going on. The overall rating is determined by 3 subsets: the health inspections, the staffing, and the quality measures. If you notice next to overall rating where it says 5 stars, there is a underlined area. It says learn how Medicare calculates this rating. Anytime you see something like that, you can click on it and it will provide you more information. So the first subset that we're going to be talking about is health inspections. One of the requirements of a long-term care facility is that every year you receive a survey by at least every year you receive a survey by the Illinois Department of Public Health. And they come in and they look at your nursing care, your dietary care, the environment, housekeeping, everything that's going on in your building. And then they give you deficiencies based on what they find. So the second part of that is your complaint surveys. So there are, you might have a concern that somebody calls into the Department of Public Health and they come in and investigate, and they may or may not write you a deficiency based on what they find. Now, the couple of important things to note. First of all, the inspections go back 3 years, so it's 3 years worth of data. But the really important thing to understand about that data is it really is a snapshot in time. So they come in for the annual survey. They're at the facility 3 to 5 days, depending on the size of the facility, and they make recommendations. But again, it's a snapshot in time, and it's based on what they find at that moment. So like with any star rating, there can be some inherent flaws depending on what they find. But the important thing to note is that the regulations and what they're surveying people on are the same no matter what long-term care facility you go to. And the second area that you're going to be looking at is staffing. Staffing for this model consists of an RN staffing model and then an RN, LPN, and certified nursing assistant combination. So there's 2 different subsets that make up the subset of staffing, and that's the RN, overall RN staffing, and then overall nursing staffing, which is the RN, LPNs, and certified nursing assistants. What this staffing star does not talk about is physical, occupational, and speech therapy. It doesn't talk about social services. It doesn't talk about any kind of psychosocial services. It doesn't talk about any kind of recreational therapy or activity services. It doesn't talk about, housekeeping and dietary. So while it's a good measure, because most of the time when people are going into skilled nursing facilities, they need nursing care, why it's a good measure to talk about what's happening, it certainly doesn't reflect all of the staff that may be in the building. And then the last measure is the quality measure. Now, again, the quality measure, again, is a 4-quarter snapshot that they look at, and it looks at 3 different sets of values. It looks at short stay measures that are for people who are at the building just for short-term care. It looks at long-term care measures. So it looks at individuals who are at your building for long-term. And then it looks at some claims-based measures that include return to hospital, return to ER, and some pressure ulcers. And again, when you click the view the quality measures, it will show you each of the different measures that someone has data for, and and where they rank based on that measure. So that's really good. The other things that you will find that are not included over on the rating system, but are really important, are the vaccination and booster rates. This will show you the COVID vaccination and booster rates, not only for the individuals in the facility, but also for the staff that's currently working in the facility. The one thing that I will caution you when you look at facilities that have a large short-term population is that the number of residents who are boosted or vaccinated obviously is changing in the building about every 14 days. So that information, while helpful, is not quite as helpful as if you had facilities that, again, were long-term, because those residents are staying there. The next set of data that's included on this page, again, not included in the 5-star ranking, but is an important part of the data, are the fire safety inspections and emergency preparedness. As I said, every year someone has a health survey by the Illinois Department of Public Health, but they also have a fire safety inspection where they come in and look at, do you do fire drills, and do you have your fire systems in place, and do you have your other things in place if you have severe weather, the generator goes out or something like that. So those inspection results are there. The next category talks about penalties. So if your facility would have some kind of penalty where they got a fine, or they had something else occur, they lost their Medicare ability to bill or whatever, that would be included under view penalty details. It also shows you the number of certified beds, the type of, is it Medicare, Medicaid? Is it part of a continuing care retirement community, which also would include someplace with had assisted living or independent living? And then it looks at what type of liability, is it for profit, not for profit, and what the legal business name is. Again, if you want details regarding the ownership, it's there. And then it closes with just the directions to the facility, as well as the address. While the 5-star system is a great place to start, and it is a great tool to determine your next steps, I strongly encourage individuals looking for post-acute care, whether it's long or short-term care, to go look at the facility and meet the people. Like with any review we look at, it's only as good as either the information that's there or the person reviewing it. So I really strongly encourage you to go and look at the facility, get a feel, figure out what kind of patients are there, look around to see if it's someplace that you would feel comfortable putting your loved one.
So thank you so much, Michelle, for giving us an overview. I think it's really helpful, and especially if this is all new to you in general as a consumer, it could be very overwhelming when it comes to making these really important decisions, especially choosing a facility. Is there something where you feel that how do you think this star rating system, in your opinion, could actually be improved? Do you think there's a certain area like that isn't always addressed? I know you mentioned contacting the facilities and learning more. Where do you feel as a consumer, if you're looking into it and you're going to contact the facility, what do you think is a really important thing to bring up when you make the phone call that you may not see here in the star rating?
Right. Right. Well, I think it's really, again, as I said, I think it's first of all really important to be able to go in and look at the facility and tour the facility. I know that that's been a little bit more difficult with COVID and things. I also think it's important to figure out what types of residents live at that facility. So for instance, if your mom has dementia care and the facility doesn't have any dementia care programming, even if it's a 5-star building, it might not be the best place for your mom to live. If your loved one has a wound that needs cared for, I would definitely want to ask them about their wound care program, because maybe you'll look at the quality measures and it looks like they have a lot of wounds, but they might have a lot of wounds because they care for people with wounds. So I think it's really important to figure out the kind of care that your loved one might need and see if that's the kind of resident or the kind of consumer that the person cares for. I think much like when we go to, if we need medical care and we need to have our hip replaced, we might look to see what are the best orthopedic physicians. And I think this is the same way. I think if your mom needs, dementia care, or your loved one has a wound and they need that wound cared for, or your loved one has a severe mental illness, you're going to want to go to a place that specializes in that kind of care. If your mom is on a ventilator, you're definitely going to want to look for a place that provides ventilator care. So part of that conversation needs to be, what type of residents do you care for, and what's your core competency? What's your specialty?
Thank you. Another question I have is, and I think this is available, you had mentioned that these facilities are reviewed annually, if they're surveyed annually, and this data goes back 3 years. What if you wanted to look into complaints that have been put out against a facility? So I think, for us as a consumer, we usually go to Google reviews, right, to see what are the positive and negative reviews. What can you tell someone who's watching this right now? How can they go back and see if there was a complaint? Where do you look within this rating system, and how, just to obviously give people peace of mind if they wanted to know about that?
Well, that's under the health inspections. So it includes not only the annual survey, also includes any complaint surveys that the facility had that there are actual findings of. If the facility did not have any findings, if public health came in and investigated and said, what the family or the person who complained alleged, we did not find any evidence of that. You're not going to find information about that. But if they came in and they said, yeah, there is an issue here, you're going to find that information there.
Okay, well, thank you again, everyone, for joining us. We appreciate you watching our Thrive Ahead YouTube channel. We hope this video is helpful for you. And if you have any questions, feel free to reach out to us. Our website is thriveahead.com, and all of our center locations, their information is on that website. It's also here on Nursing Home Compare. So if you wanted to type in one of our specific centers, we're located in Aurora, Illinois, Thrive of Fox Valley, Thrive of Lisle, which is in Lisle, Illinois. And then we have Thrive of Mundelein, Thrive of Lake County, which is in Mundelein. So you could search for any of our facilities here as well, but feel free to reach out if you have any questions. And thank you so much, Michelle, for providing this for us today.
No problem, Lisa. Have a good day, everybody.
Thanks for checking out today's video on the Thrive Ahead YouTube channel. For more helpful videos and tutorials, click subscribe today.